Thank you, everyone. Thank you for joining us. Dr. Letha Maybank. This is the after show for our Prioritizing Equity series. This one, Learning Lessons from New York City. I have Dr. Dimitri Dakalaskis, Dr. Torian Easterling, Dr. Neil Vora with me to talk about the after show. We had a great conversation. And I just wanted to get a little deeper in some conversations, but just also for you all to bring up whatever else you wanted to bring up. Um, and some questions that came from the audience as well, that we figured to answer. But the first thing that I want to touch base on, so during the conversation, Dr. Vora, said the word sex. And there's nothing wrong with saying that, but it triggered something in me in terms of, I think, the leading work that New York City Department of Health has done, really under the leadership of Dr. Daskalakis, of having sex positive messages. And when COVID really first came to the forefront, there was guidance that y'all put forward. So can you just talk about that? Why? How is it
Sure.
received and all of that? Yeah.
I can start by saying it was received by making most of late night comedy shows and Saturday Night Live. So we made a splash by making public health go prime time, which is great. Actually, the guidance around COVID and sex really comes from the experience with HIV in the early 80s. There was a document that was produced by the community in New York City called How to Have Sex During an Epidemic, One Perspective or One View. And so I actually used that document and workshopped it with folks at the Department of Health to create a COVID style document, a COVID document that was in the same style, giving people harm reduction strategies during the pandemic. And we evolved it as the pandemic changed, getting a little bit more actually explicit in our recommendations. And I'm happy to say that that our guidance was picked up by multiple jurisdictions, most notably all of Canada.
I saw that.
Yeah, so that was really exciting. And so I think it comes from like the harm reduction space that the Department of Health lives in general. And so though the sex guidance made the biggest news, we had guidance around safe protesting, guidance around safer gatherings, guidance around safer drinking, guidance around drug use. So really from the beginning of this, we moved it immediately into a harm reduction space, just knowing that that's the way that that you really should do public health.
Absolutely. So that's really useful to know. Dr. Easterling, folks wanted to know, like, could you tell us any more about, your process of like geolocation of the testing sites? And any of y'all can chime into that. But, Dr. Easterling, can you start with that? Like, how did you, the maps have been excellent. I've used the maps still to this day. How do you do that? What do you do?
Yeah, well, specifically for, our hyperlocal response. So, just starting back during the peak of wave one for this pandemic, we've already identified priority neighborhoods and, using our data and wanted to have a data-driven strategy. We use COVID-19 data, but we also lined it up with chronic disease prevalence, specifically hypertension and diabetes, since we knew that, they were going to be at higher risk based on individuals in those communities. So we wanted to look at and prioritize those communities that based on COVID-19 data, but also chronic disease data as well. And so we've already had that list. And then while we started to look at neighborhoods that continue to have higher percent positivity, we lined it up with our priority neighborhoods because, again, we understood that there were going to be other sort of social factors that we need to consider as we were rolling out the New York City test and trace operations. And so, Tremont was on that list as well as Sunset Park. And, I think we've already knew, again, during the pandemic, certain neighborhoods that were lighting up, South Bronx, as well as Southeast Queens, and North to Central Brooklyn, parts of Staten Island as well, Manhattan, not so much, although Northern Manhattan, we did see some signals. And so the maps were super helpful. We have some really amazing, staff that really use our GIS software, and so they can create these maps really well. But it's also important for us to think about how we can get more granular information. And so that's where our qualitative data was super, super important. So we, our team started to build out a qualitative tool and started to, look at some of the factors that were leading to community transmission. So we were actually coupling both quantitative and qualitative data.
Got it.
Others may want to just add other information.
The other part, I was wondering, to the testing part, just real quickly, New York City, it seems like, and this came up in a question too, about the rapid testing, and I've heard, across the country, the concern about rapid testing and the machine and et cetera. Why is it and how is it that New York City is able to do the rapid testing in that way? And what are you all learning from the rapid testing? And how are you kind of sharing that? Because a lot of feedback we get, a lot of people haven't been using that machine, or they've been concerned about the results, let's put it that way.
Do you want to take it?
Yeah, I can start. So from the lab science perspective, at least the machine that we were using, the instrument that we were using, its specificity was very, very good. Its sensitivity was not as good. And so what we were doing was, like if a result was positive, we called it positive. If a result was negative, we were doing as the emergency use authorization requires or recommends for that instrument, we were doing lab-based testing of all the negatives. And so we did definitely find some individuals who tested negative who were actually positive on lab-based testing. And so I think the testing horizon is going to change a lot. The technology is moving really quickly. Lots of debate about really, like, are we using testing that is in fact too good? Is it too sensitive? And we're detecting people who are potentially not infectious. I think it's a moving target. But I think for us, we decided that it was important to use, at least in these local responses, testing that provided an answer at the point of care so that we could then pass off to other individuals who could do the navigation necessary to keep people safe. And I think that that's our model, especially in these areas where they have historically during the pandemic have had lower rates of testing. So the notion being that that we'll back up the imperfect with something more perfect, which is a lab-based testing. But meanwhile, there is definitely a premium to getting your information quickly.
Got it. Thank you. And as we close out this section, I just want to hear from each of you. Like, I'm not going to say what have you learned, but what is the one thing you hope will be different as we move to whatever this next phase of who we are as human beings within this world and within this country, based on kind of what you've learned through this whole time? What is that change that you really want to see moving forward? Dr. Vora?
Thanks. I'll say two things on this thing. And I think they're both existential threats to humanity. One of them is the spread of misinformation. Whether we're talking about vaccine denialism or use of masks or whatever it is about COVID, that is threatening the health of people, but also altering our perceptions of reality, right? We know that there's structural racism and inequities in how we treat certain people. And because of coordinated, deliberate efforts to spread misinformation, we are behind the 8 ball. And I think that is a huge threat to the future of humanity. Number two is the state of the planet. Emerging infectious diseases are on the rise. We know that since the 1940s, whether we're talking about viruses such as Ebola viruses or COVID or a range of other different viruses. These viruses are emerging with greater frequency because of human-driven alterations of the planet. I'm talking about climate change, and I'm talking about deforestation, wildlife trafficking. All of these factors are going to continue to put us at risk. And unless we start thinking with a comprehensive view of public health, that we need to take care of more than just the human in front of us, but also the planet and animals, we're going to continue to see an increased frequency of the emergence of deadly viruses.
Thank you. Dr. Easterling?
Sorry, I'm getting all these people walking by. I haven't seen in months. Yeah, so what I would like to see, we want to reimagine a new community, new world. Yeah, just piggybacking off of Dr. Vora, I do want us to be able to lead with more sensitivity. just thinking about, Chadwick Boseman and some of the conversation that came up, when we first saw that he was losing weight, or even just thinking about COVID-19 and thinking about the stigma, the bias, the wording that was coming up around certain communities, and so leading with grace in our conversation. I think that we have more than enough examples why that's so important. And then I would also say that I've sort of grown in this work a bit in this response now that we have an equity officer in really supporting. And so I just need to shout out Dr. Daskalakis, who's been our incident commander since December 2019 and really spearheading this work. And I think that it's so amazing that we have leadership like Dimitri. Since we're after show, I think it's fine to say first names. but
Of course.
But it's interesting because during peacetime, I feel like there's more bureaucracy to get things done, and I feel like now when we need to get funding for CBOs or we need to get something out, yes, there are challenges, but I just hear a different conversation now. Like, let's do this. We need to get this done. How can we remove the barriers? Can we do that during peacetime? Can we come together and and remove those silos and those barriers so that work can move forward faster? I think we could, and there's no reason why we can't do that.
Yeah, I think there was a recognition of that. That was the whole point of the neighborhood health action centers, right? And the Red Cross at that point in time, recognizing the same thing and trying to create a system. But that's the ebb and flows of politics that happens in leadership that kind of changes that kind of thinking. Dimitri.
So I'm going to
with you.
Ditto Torian and say that the leadership is actually Torian's and not mine. So thank you very much,
Both
Torian,
of y'all.
It's
all of y'all.
Thank you for being such a leader. I take away from this a couple of things, and probably because of time, I'll keep it to one, which is that public health cannot be dismantled. And there's slow dismantling and there's fast dismantling. And I think at the beginning of the pandemic, and I think Aletha, you brought this up, like we realized how sorely underfunded public health was and continues to be. And so I think that when you see a threat of the magnitude of this, which is in effect, what I remember saying in March, the equivalent to a slow atom bomb hitting New York City, like public health, I think is now being resourced in a way through its broad collaboration to be able to really be prepared for a second wave. And so I think that as we are, getting to a point where we leave suppression and actually go into recovery when we have a vaccine that works for this, it's going to be critical that we don't dismantle the work that we've established to make sure that we're prepared both for this pandemic, the next one, and many other health emergencies. So that's I think my biggest one to grow on.
Thank you. That's amazing. Thank you. So thanks again to you all. Thanks for the after show, Neil, Torian, Dimitri. Appreciate it and appreciate you all.